So the most common symptoms that patients complain about are tired, heavy, achy legs that get worse with prolonged standing. It's usually worse by the end of the day, and it can be associated with leg swelling. Other complaints that are common are cramps, especially cramps at night, and a feeling of restless legs. So we see a lot of patients who come into the office who complain of pain that either starts in their lower back or their buttocks, extends down the side of their leg and into their calves. And in bad situations, it can even go down into the foot, in between the first and second toe, and in some situations at the bottom of their feet. If that kind of pain is also associated with burning, that's a nerve pain or sciatica type pain. Other pain that we see is often pinpoint type pain. So a patient will point to a specific area on the back of their thigh, or more commonly on the side of their legs. And that's muscular pain or a tendonitis type of pain. And that pain can usually be differentiated by worsening pain with movement. And then finally, if you've got pain or swelling that's isolated to a joint, that's usually not vein-related pain. Vein-related pain is more global. It's not isolated to your knee or to your ankle or to your hip. That's usually an arthritic type of pain. So lately, what we've been seeing in the post-COVID patients is that those of us who have been sitting at home or have not been ambulatory or have not engaged in our normal activities, when you start to get back to those normal activities, people are getting muscular type pain. But people are concerned that this might be a sign of a blood clot because now they've heard that COVID or the flu vaccine is associated with a blood clot. And so they're worried that this new pain that they're experiencing may be a blood clot. 99% of the time it's not. It's just the fact that you haven't been using your muscles, and now that you've been exerting yourself again, people are starting to get muscle pain. First thing we do is we're going to ask a history. So we're going to want to know if you have tired, heavy, achy legs, if it gets worse by the end of the day, and if there's swelling associated with it. The next thing we'll do is we'll look at your legs. Do you have any evidence of big, bulgy varicose veins? Do you have any skin damage? And what I mean by skin damage is that the color of your skin will change to a dark brownish color. In severe cases, that skin discoloration will be associated with scar tissue. So you're going to lose some of that supple, soft feeling of the skin, and it's going to become very, very hard and woody. So if we see, and then finally, the worst case scenario is if you have an open wound. So if you have an ulcer that's on the inside of your ankle or the outside of your ankle, that could be venous related, especially if it's associated with pain, swelling, and skin discoloration. Vein related, the first thing that your doctor is going to do is going to send you for an ultrasound from your groin all the way down to your ankles. And in that study, we're going to be doing two things. One, we're going to be making sure that you don't have a blood clot. But more importantly, we're going to be looking at the function of your veins. We're going to look at the veins underneath your muscles, which are your main veins. And then we're going to look at the two big veins that are underneath your skin, one on the inside of your thigh and one on the back of your calf. Then once we get the results of that ultrasound study, we're going to go over the results with you in the office. And then we're going to look to see if you meet your insurance company's criteria, because even though you may have big bulgy veins, if the ultrasound doesn't meet the insurance company's criteria, insurance doesn't cover it. And then we'll offer you a variety of options based upon what your ultrasound and what your physical exam shows. So I haven't met a patient yet who hasn't said that their spider veins bother them. 98% of these patients are women, and usually the spider veins become hot or tender or painful during around the time a woman is having her menses. Unfortunately, insurance companies don't consider those to be symptomatic varicosities. They consider those to be cosmetic issues, and they're not covered by insurance. But at Center for Vein Restoration, we're very inexpensive, and we can take care of your spider veins at a very low cost to the patient. A great question. So oftentimes we see many people who have big bulgy varicose veins and they have absolutely no symptoms whatsoever. Remember, vein disease is not limb threatening and it's not life threatening. It's a quality of life issue. So you should seek medical attention if you're starting to have symptoms that are affecting your quality of life. And specifically, if you're having tired, heavy, achy legs, pain that's associated with prolonged standing, pain that's worse at the end of the day, leg swelling that requires leg elevation or for you to get off of your legs, anything that's affecting your quality of life that's related to your veins, that's when you should seek medical attention. Finally, you should also not let it get to the point where you have skin damage or a wound. By then, we're looking at severe forms of vein disease, and you don't want it to get it to that point. So if you have the big bulgy veins with symptoms, that's when you come and seek medical. Challenge for most primary care physicians and even specialists is to try to differentiate the types of different pain that you're having and what may be the cause of it. So let's deal with non-vein related pain for a second. So we already touched on sciatica. So the sciatic nerve comes from the lower part of your spine. It typically travels underneath your buttocks and it goes through a muscle. And if that muscle goes into spasm, it can cause pain in your leg. Then it travels down the side of your thigh, and then it goes your entire circumference of your lower leg, and then it goes into your foot, either between your first or second toe, or worst case scenarios, it can be the bottom of your foot. That kind of pain is usually burning type of pain in your feet, but it irritates the muscles of your leg. So people have a lot of tenderness in their muscles. They get problems with the range of motion where they can't extend or they can't be as flexible as they used to be. So that's muscular kind of pain related to sciatica. Then there's a piece of tissue that goes from the top of your hip down the side of your thigh, and it attaches to the outside of your calf. That's called your iliotibial band, or otherwise known as ITB band syndrome. The ITB band, when it becomes inflamed, develops scar tissue, which then affects the muscles of the front of your thigh and the back of your thigh. It's very, very, very uncomfortable. And because it attaches to the top part of your calf, it can cause posterior calf pain as well. A lot of people also get their hamstrings affected by this as well. And the hamstrings have two heads to it. One that goes to the outside of your knee and the other that goes to the inside of your knee, and it runs up the back of your thigh. So a hamstring injury is horrible because it can take months for it to get better, and it requires stretching and physical therapy to get rid of the hamstring pain. More severe forms of pain are related to your arterial circulation. So vascular surgeons see many, many patients who have blockages in their arteries. Now, unlike vein pain, that is limb-threatening, that is life-threatening, because people have blockages in the arteries of their legs, oftentimes have blockages in elsewhere in their body, particularly the heart or in the neck that goes to the brain. So those people are called claudicants. And what happens is an arterial blockage in the legs, patients say that they can walk a certain distance, typically 1 or 2 blocks. They have to stop for 5 or 10 minutes. The discomfort eases to the point where they can walk again, but they can only walk 1 or 2 blocks again before the pain starts. So the pain is always reproducible, and it happens when you're walking, unlike vein pain, which can happen even at rest. So arterial pain is something that needs a full assessment because that is limb-threatening and life-threatening. And oftentimes people need cardiac evaluations and they need a full physical exam. Vein pain is not limb-threatening and it's not life-threatening. It just makes you miserable and uncomfortable. There's one more type of pain that's similar to arterial claudication. It's called neurogenic claudication. And in that circumstance, pain happens when people walk again, but the distance varies. People have good days, they have bad days, and oftentimes when they stop, the pain doesn't go away, they have to sit. And the reason for that is that their spine or their discs are bulging and pressing on the sciatic nerve, causing pain. So that's why they have good days and bad days, because if the disc isn't bulging too much, they can walk further. If it's bulging a lot, then they can't walk as much. So that's neurogenic claudication, which is differentiated from arterial claudication. And finally, there is a venous type of claudication. We see that in people who have severe venous disease. And what patients say is, doc, I feel like I'm walking around with buckets of water in my leg, or I have this bursting sensation in my calves when I walk. So that's uncommon. We don't see that very often, but it is a third type of pain that the doctor needs to differentiate. But a lot of the pain that we're seeing in our offices these days is muscular type pain or sciatic type pain. I'm telling all of the patients that if they haven't had a set of plain x-rays of their spine, they need to start with that. The other thing is to get some temporary relief for lower back and leg pain. I think that's a place where chiropractors have a big role, where they can adjust the spine, relieve the spasm, and help with the lower extremity pain. Physical therapy is very good for this because they can assess where the muscle pain is coming from. And then finally, especially for iliotibial band syndrome, deep tissue massage is essential, because what will happen there, they're breaking up the scar tissue that's formed in that tissue, and you need to do it 5 or 6 times before you see any long-term benefit for this, because if you just do it once, the scar tissue is going to reform and you're not going to get any benefit out of it. So chiropractic care for temporary relief, you set of x-rays to find out if the spine is involved. If the spine is involved, your primary care physician may want to get an MRI to see if you've got any bulging discs. If you know you have bulging discs, then pain management and physical therapy are the next best options. And then finally, the last thing or the last resort is if you've exhausted all those other things, then you need to go see a spine surgeon to see if you're a candidate for any kind of spine surgery. But most people don't want spine surgery, but the good news is the majority of people don't need it. Physical therapy and pain management, and 90 to 95% of the time, manages the problems, and you can avoid spine surgery. I think the main thing that I want people to understand is that in this pandemic, in this era of COVID, even though you can get a blood clot with COVID, it's still very uncommon. But if you're concerned and you think you've had COVID, or you're worried that you may have a blood clot, it's an easy test to do. We can certainly do it for you. But in the majority of patients, it's normal. So we don't find any blood clots, but the only way to know for certain is if you do the exam. I don't want people to be frightened about this. If you're having leg pain and you just don't know what it is and you think it's something more than muscular pain, or your physician is concerned about it, of course, please come in. We're going to assess you. We want to put you at ease. But the majority of the time, it's just muscular pain or some other kind of sciatic pain or ITB band stuff. So the blood clot, even though you hear a lot about it in the news, it's really not that common, but it's not zero. So just whatever you need, we're here to take care of it for you.